I'm John Strum, and this is RealTalk MS. It's January 14th, and we have a lot to talk about. But first, I want to thank all of you who have checked in on me as Southern California was on fire for most of last week and continues to burn today. I live in the Los Angeles area, but LA covers a lot of ground, and I'm one of the lucky ones who didn't see their neighborhood go up in flames. LA County is the most populous county in the United States, covering more than 4,000 square miles that are home to over 9,600,000 residents. It's a population larger than 40 individual U.S. states. And the city of Los Angeles is home to about 3,800,000 of those residents. I'm a 30-minute drive away from the closest and largest of the fires, the one that destroyed much of Pacific Palisades. I know people who have lost their homes there. Neighborhoods that I've walked through thousands of times have been completely erased. Homes, schools, churches, libraries, and businesses gone. I don't think there's a way to adequately describe the level of devastation. And I have no doubt that there are people affected by MS who have been displaced by the fires. I know the National MS Society is ready to assist in any way possible. So please reach out to an MS navigator and get connected to the resources you might need. You can reach an MS navigator by phone at 1-800-344-4867, by email at contactusnmss@nmss.org, or on the MS Society's website by chat. Please be sure to get in touch. They're ready to help. Former First Lady Rosalynn Carter said there are only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregiving. Most of the almost 3 million people living with MS need support at some stage following their diagnosis. This means that a substantial number of partners, parents, extended family members, and friends find themselves caring for a loved one with MS, aiding with everything from simply managing medications to accomplishing the most basic tasks of daily living, like getting out of bed or even brushing their teeth. And the progressive and long-term nature of MS means that MS care partners take on a responsibility that often increases over time and can last for decades. Research has shown that this contribution comes at a high cost, as care partners themselves face an increased risk of reduced health and well-being. The National MS Society reports that 64% of MS care partners report feeling emotionally drained, 32% experience depression, and 22% have lost a job due to their caregiving responsibilities. Additional research has shown that long-term family care partners face a more limited lifetime earning potential, along with a shortened life expectancy. Care partners often remain invisible throughout their care recipient's MS journey, as they're the ones who are left to deal with the financial, physical, and emotional burdens that go along with supporting a loved one who's living with multiple sclerosis or, frankly, any chronic condition. And when MS care partners turn to the web for information that can lighten that burden or connect them to other support resources, navigating through the unhelpful information to find the information that is helpful becomes hard, time-consuming work. And one thing most care partners don't have is an abundance of time. That's what makes mscarepartnerconnection.com, a new support portal for MS care partners, particularly useful, because every link that you'll find has already been vetted by a team of MS care partners. And you'll hear more about that team a bit later when you meet a member of that team, my guest, Craig Bianco. But before we get to my conversation with Craig, there are a few other things that you should know about. In last week's episode, I shared some news about the $2,000 a year cap on out-of-pocket costs for prescription drugs for people on Medicare, and I want to correct some of the numbers I originally shared with you. Now, just a reminder, this isn't new legislation. This is part of the Inflation Reduction Act that was actually passed in 2022, with this particular piece of that legislation becoming effective this year. Last week, I said that about 250,000 people with MS are on Medicare. Thanks to the National MS Society's advocacy folks, I have an updated number. And it turns out that almost 400,000 people with MS rely on Medicare for their health insurance, and that would include their prescription drug coverage. I also mentioned that the Department of Health and Human Services had calculated that this $2,000 cap on out-of-pocket costs for prescription drugs would save an individual about $1,500 a year. Well, that's true for the average person on Medicare, but not the average person with MS who's on Medicare. Because the cost of MS prescription medications is so ridiculously high, the average annual out-of-pocket spending for Medicare beneficiaries with MS, just for their disease-modifying therapies, was almost $7,000. So this new $2,000 cap on those out-of-pocket costs means a savings of $5,000 a year. And when it comes to benefits for people living with MS who are on Medicare, there's more good news to share. Every January 1st, every insurance company in America, including Medicare, resets our deductible at zero. That means that depending upon how high or low that deductible is, you're paying a lot more out-of-pocket over the first few months of the year. And even with that new $2,000 cap on those out-of-pocket expenses, $2,000 is still a lot for someone on Medicare to have to pay all at once in January or February for their MS disease-modifying therapy. Beginning this year, the Medicare Prescription Payment Plan is a new option that allows anyone with a Medicare prescription drug plan to spread their out-of-pocket prescription drug costs over the course of a year. That $2,000 out-of-pocket cap still applies, but now you can spread that $2,000 over 12 months instead of having to pay all or most of it in the first couple of months of the year. And once again, this is not the result of new legislation. Just like the $2,000 cap on out-of-pocket costs for prescription drugs, the prescription payment plan is also part of the Inflation Reduction Act that's taking effect this year. These gains, these changes that, without question, make life easier for families affected by MS, these are the things that MS activists have spent significant time and energy advocating for. Advocacy moves the needle when it comes to getting legislative support for the things that improve the lives of people living with MS. If you aren't yet involved in the National MS Society's advocacy efforts, I hope you'll visit nationalmssociety.org/advocacy and find out how you can get involved. And you'll find that link in today's show notes. One more bit of good news. Just last week, the Consumer Financial Protection Bureau, that's a U.S. government agency that protects consumers from unfair treatment, enacted a rule that removes medical debt from consumer credit reports. Now, how many people does this rule affect? It actually removes $49 billion in unpaid medical bills from the credit reports of 15 million Americans, raising their credit scores by an estimated 20 points. As most, if not all of you can appreciate, medical debt is different from other kinds of debt. Most of the time, it's a function of unavoidable health complications. No one chooses to get sick. And now, getting sick or experiencing a medical emergency won't mean that someone is going to be denied opportunities like owning a home, getting a small business loan, or being approved for a car loan so they can get to those medical appointments more easily. I can tell you from my own experience that medical debt absolutely destroyed my credit score, and it's taken me years to rebuild it. Having gone through that experience, I am so grateful that because of this rule, others won't have to do that. And once again, this was not legislation that went through Congress. This was a rule enacted by the Consumer Financial Protection Bureau at the urging of the Biden administration. And last August, the National MS Society joined 24 other national patient advocacy organizations in submitting comments in support of this rule to the Consumer Financial Protection Bureau. So, some real benefits that will make life a little more manageable for the 40% of the people with MS who rely on Medicare for their health coverage, and the 15 million Americans, both with and without MS, who will see their medical debt disappear from their credit reports. I think that qualifies as a great way to start the new year. While we're talking about new rules, last month the Department of Transportation adopted new rules aimed at protecting the safety and improving the experience of airline passengers with disabilities. The new rules require enhanced annual training for airline personnel who physically assist passengers with mobility-related disabilities or handle mobility devices. This training has to be in place by June 17, 2026. The new rules also clarify that airlines must provide prompt boarding, deplaning, connecting, and terminal moving assistance for passengers with disabilities. This includes passengers who use a boarding chair. Airlines are required to deplane passengers who use boarding chairs after the last passenger has exited the plane and, upon request, have that person's personal wheelchair as close to the aircraft door as possible. Airlines are also required to notify a passenger when their mobility device is loaded and unloaded onto a plane. And that notification for boarded mobility devices must happen before the cabin door closes. The new rules address damaged and mishandled mobility devices, making clear that there's a presumption that if a wheelchair or assistive device is not returned to the passenger in the same condition as the airline received it, then the airline is responsible for any damage. Now, the airline can still contest that presumption by showing that a wheelchair was already damaged upon receipt by the airline or after it was returned to the customer. And passengers can now choose between having an airline promptly repair or replace a damaged mobility device, or they can choose their own vendor to make repairs. Now, if a passenger chooses to have their own vendor make those repairs, the cost of transportation and device repair must be covered by the airline. And airlines must provide a loaner device while those repairs are being made, and they're required to work with the passenger to try to meet their individual needs. Passengers are now allowed to find an alternative device that better meets their specific requirements, and airlines must reimburse passengers for the cost of those loaner devices. The final new rule requires airlines to cover the cost difference for passengers who are forced to book a different flight if their mobility device doesn't fit into the cabin or cargo compartment of an aircraft. Airlines now have to offer to deplane and rebook passengers if their mobility device is not loaded onto their scheduled flight for whatever reason. This rule is effective 2 days from today, on January 16, 2025, with some provisions taking effect over the next couple of years. I remember being at the National MS Society's Public Policy Conference a couple of years ago and listening to Dr. Scott Crawford, who lives with MS, talk about his experience flying with his power chair and giving a great lesson in how someone traveling with a mobility device can advocate for themselves in real time while they're at the airport. If you'd like to hear Scott share some of this incredibly useful information, I hope you'll check out episode number 302 of RealTalk MS, and you'll find a link to that episode in today's show notes. Just a couple of years ago, researchers were able to determine that the Epstein-Barr Virus, or EBV, was a trigger for multiple sclerosis. Now, other factors still need to be present, and researchers are working to identify what those environmental and genetic factors might be. But if you can imagine a gun for a moment, it's easy to understand that without a trigger, that gun won't fire. And experts believe that preventing infection from the Epstein-Barr virus will prevent MS from developing. EBV is one of the most common human viruses, infecting somewhere between 90 and 95% of the world's population. Now, obviously, 95% of the world doesn't have MS, so it's important to keep in mind that the Epstein-Barr virus isn't a cause of MS, but it is a necessary ingredient. It's been shown that some EBV proteins are very similar in structure to certain other proteins in the brain, leading some experts to believe that when the body mounts an immune response to fight the Epstein-Barr virus, it may inadvertently attack healthy parts of the central nervous system, causing the inflammation that leads to demyelination. The Epstein-Barr virus has also been linked to other autoimmune conditions and cancers, and today EBV vaccines are under development in a number of laboratories. Last week, Modex Therapeutics, in collaboration with Merck, announced that they were beginning a phase 1 clinical trial for their investigational Epstein-Barr virus vaccine called MDX-2201. The trial will enroll 200 adult participants at several sites across the United States to test the safety and tolerability of MDX-2201, which is administered through 3 injections over a 6-month period. Phase 1 clinical trials are typically used to determine the safety and tolerability of a drug. This trial will also assess the vaccine's ability to mount an immune response against EBV over a period of about 18 months. MDX-2201 is a nanoparticle that carries pieces of 4 different EBV proteins. It's designed to sort of train the immune system to recognize these proteins as harmful so that the body mounts an appropriate immune response if it ever detects EBV. We'll keep you updated on this trial as it progresses. I always try to remind people that MS doesn't just impact individuals, it impacts families. That can often mean that a spouse, partner, or other family member takes on the role of care partner. And with that role comes an awful lot of questions. MSCarePartnerConnection.com can connect MS care partners to reliable, curated information that will answer a lot of those questions. In a moment, we'll meet my guest, Craig Bianco, who is part of the Care Partner Advisory Board responsible for vetting all those resources and building this portal. Former First Lady Rosalind Carter once said, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." So, for those of you who are caregivers or who will be caregivers, I've been telling you about a new online resource, a web portal which, thanks to the generous support of EMD Serono's Embracing Carers initiative, is operated by I Conquer MS and was especially designed for MS caregivers by MS caregivers. You can find it at mscarepartnerconnection.com, and full disclosure, I was one of the project co-leads in creating mscarepartnerconnection.com. What makes this resource unique is that everything that appears on this website, every single link, has been curated by a Care Partner Advisory Board. And joining me today is a member of that advisory board, Craig Bianco. Welcome to the podcast, Craig.
Hi, John. Thanks so much for having me.
I know you're a caregiver for your wife. Would you mind telling us her name and when she was diagnosed with MS?
My wife's name is Faye. I met her in 1995. I married her in 1997, and she was diagnosed with MS in 1999.
And how would you describe your care partner responsibilities?
Since Faye's MS has left her completely paralyzed from the neck down, she has no use of her limbs. She can't move her hands. Everything's super from the neck up. So she is wheelchair bound, and she needs 24/7 care. It's not that she always needs something from someone, but we always want someone with her. Something as simple as her nose itches. She can't scratch it. So she might ask, "Can you please scratch my nose?" So the activities of daily living that we all need to do, like get out of bed, toileting, getting your clothes on, feeding yourself, and moving about, Faye needs help with all of those things. So I'm here for her, with the exception of about 16 to 20 hours per week.
And in your absence, then there is someone to stand in for you?
We have two wonderful friends from the community. One works for us 2 days per week, and she's a whiz. She's fantastic. Her and Faye are good buddies. It's a win-win. So I have time to do mostly chores, errands, take care of the house, shopping, things like that. I trust her 100% with Faye's care and well-being. So that leaves me freedom to go do the things I need doing. And then we have another friend who comes over like every other Sunday, and she's also fantastic. So we're very, very lucky.
Well, in some of the time you've carved out for yourself, I know you used your experience as a care partner to assist in this project, building mscarepartnerconnection.com. First, what made you want to get involved in the project?
Pretty simply, John, when Faye was diagnosed with MS, I remember vividly how frightened we were, how lost we were. We didn't know what the future would hold then. And she was really just having minor symptoms comparatively at that time. But as things progressed and she was unable to walk as far, or she couldn't see as well, or she could, many things were happening, we were lost as well and frustrated. And it seemed like the doctors really didn't have resources for us. But then we were lucky to find our local MS Society, and we reached out to the MS Society. And then through the MS Society, we got some counseling, and we also were turned on to a program that's now called the Can Do MS program, which was life-changing. And so since there wasn't really a go-to resource, even with the MS Society, there was certainly nothing geared directly to the care partner. They actually, I think, that didn't really want to talk to the care partner. They just wanted to talk to the person with MS at the society. I don't know if they've changed. The Can Do program was so fantastic in that they focused on the patient and the care partner, whether it was spouse, sibling, wife, friend, whatever. And I saw all the enthusiasm from all of those folks. And so I felt like I had a little something to offer and wanted to take part in this so that there is a resource for care partners out there that are scared and don't know what to do or where to look. So we tried to put all of our knowledge as care partners in one place. Like, what would someone caring for someone with MS, what questions would they have? And I think that's what we tried to do with carepartnerconnection.com.
I think that pretty much everyone who was part of that Care Partner Advisory Board had a similar experience in that there really wasn't a lot available in terms of resource. Some of what was available wasn't very good, but there was a little bit everywhere. And it was a matter of kind of separating the wheat from the chaff, if you will, in determining what would be helpful versus, because one of the things I think we can agree on is that when you're caring for someone with MS, you don't have a lot of free time. You don't have a lot of spare time. And so when you want to find information, having to go through the process of figuring out how reliable it is, how current it is, how helpful it's going to be, that takes more time than you have. So I think based on everyone's mutual experience, it's what pretty much brought us together. And at least for you and I think our story is very, very similar in that regard. So when I first introduced you, I mentioned that every link on this website has been curated by our advisory board. Can you walk us through what that process was actually like?
Sure. We all got together and talked about all the challenges that MS care partners go through, and made a very, very long list. And all of us have different viewpoints. All of our partners or the people that we were caring for had MS or have MS to different levels. So we came up with a very, very long list. And then went out seeking every single site we could find and compared that. We met again and talked about those, and some of them, many of them, weren't really appropriate. So everybody from the Care Partner Advisory Board has really vetted all of these resources, and honestly, half of the advisory board are literally the top MS Care Partner advocates in the country. So it's really the best of the best.
I should probably also mention that in our advisory board, we had care partners who had a variety, they represented a variety of different roles. There were some folks who were caring for a spouse, some for a partner, some caring for someone caring for a child with pediatric MS, an adult who is caring for their mother who had MS. We ran and had been caring for her mother since she was 6 years old. So we had quite the variety, as you'll find in real life, of people who were care partners. What I like to say is members of a club that no one really ever planned on joining, but here we are. And how do we make the best of this situation? So there we were, and trying to make the best of it for other care partners who might come to the site and get some information that's going to help them have a better day, a better experience with their partner or their care recipient's neurologist, a better sense of well-being for themselves, a better handle on family finances. The information really runs the gamut in terms of the kinds of issues that families affected by MS face every day. So how would you describe your experience doing this work?
It has been very cathartic, and it has been an opportunity to really reflect on what goes into being a care partner of the level that my wife Faye requires. You just touched on a bunch of things that we went through with interfacing with the neurologist, to the financial situation, to we didn't really touch on it today, but the mechanical aspect of the ramps in the house and all of those other kinds of things. And we've been going through this since 1999. And I would say it's only in the past couple of years where Faye's disability is the most profound that we're actually the most comfortable, and it's not stressful, and it's just life. And we live it to our fullest. We love each other. It's fantastic. So it's taking part in mscarepartnerconnection.com and the advisory board has given me a chance to realize how lucky I am to be doing this for my best friend.
Well, now that the website is launched, I should probably add that the whole process we've been discussing of vetting content, our Care Partner Advisory Board continues to meet quarterly to review new content that could be added to the site or to discuss any changes or additions to the site. So like all good web resources, it's a constant work in progress. And I certainly personally appreciate all of the contributions you've made, Craig. In fact, I want to thank you for stepping up and taking on the role of Faye's care partner. And thanks so much for talking with me today.
You're very welcome, John. It's been a pleasure. I look forward to our next advisory board meeting, and always making this resource the best it can be.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/385. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free RealTalk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.